Hair loss is a common problem in men, but not just men, women suffer with it too. So we're going to get to the bottom of things today with Dr. Ward. He's a facial plastic surgeon, but you do more than just facial plastic surgery. You do a lot of things here at Ward MD, yeah?
Right, ton of things. And hair is one of the most important.
And it's been going on for so many years, but now there's so many ways to combat it. So let's talk, who are the right candidates for this and how do they choose which procedure?
Right, so, hair transplant really changed a lot in the 90s when we went from plugs, which people have heard about, like the dolls' hair plugs that look terrible. Nobody likes them. That's not what anybody does anymore. Where we actually took each follicle, each follicle maybe has 1, 2, 4 hairs per follicle, and transplanted each individual follicle. So it's very tedious, but it works, and it's your own hair. Really? The real miracle is that if you take hair from here on the side, like that horseshoe, like the classic male pattern hair loss, if you take hair from that horseshoe area and transplant it to the top of the head, it stays like from the horseshoe area, so it stays there forever.
So walk them through what a procedure like that would be. You said it's tedious, but is it like a one and done type thing? So
we get all the follicles out. Once you get the follicles, and again, those follicles, when we say follicle, we mean that's the group of cells that produces hair.
Got it.
So we transplant that follicle. So we call it a hair transplant. It's more properly called a hair follicle transplant.
Okay.
So we take the follicles and then we transplant those into the area where there's hair loss. Again, the really cool thing is that when you move it from here to here, it keeps acting like it came from over here versus the top of the head.
Wow.
So we implant them the same, but there's 2 primary ways that we take them out. The traditional way, the way that was kind of invented in the 90s, was to take a strip from the back of the head, like this really thin rectangular strip. Take that out and then you stretch the skin to close it so you have this linear scar. You take the follicles from there, implant them, close the wound, you got that linear scar as it heals. Kind of the more modern way, the way that's probably about 95% of our patients choose to do, is we individually take each follicle out. Wow. So very tedious, but take individual follicle out and put it up here.
And removing it from here doesn't affect this area.
Correct. Well, that's not true. It does affect it because it does decrease the density.
Oh, okay.
But you can lose about 50% of your hair before you even notice loss of density.
Wow.
So we usually, in most people, there's plenty of donor sites that you can take it from.
So it might be something as a simple area for men, women, whoever it might be. It might be a huge area. It could be any of the above, right?
Right. So, there is a limit to the number of hairs that we have, But I think you brought up a really important point, which is that we always talk about male pattern loss. Yeah. But if you think about it, it's almost socially acceptable for men to have hair loss. There's all these studies that show that men with hair loss have less levels of trustworthiness. They look more scary to people. The psychology of it is very interesting. But contrast a man with hair loss with a woman with hair loss. It is a much bigger deal for a woman to have hair loss, and it's much more insecurity promoting for women to do that. And the truth of the matter is that it works for both men and women.
And it's something that the men were probably very insecure about, and they just became more secure with because they got used to it, but they probably still are very insecure about it. So it's something that can be done. It's a much more modern procedure. So if it's something that men, women, whoever it is are looking into, they can contact you guys and you'll help them walk through, we could take this much hair and replace it, correct?
Right. Yeah. So it's really important to get a consultation to find out what options are available, what treatments are available, and then kind of what you can expect in terms of the result. But the really amazing thing is, some guy comes in, he's 35, 40, and when we tell him you can have hair for the rest of your life, your own hair that's naturally grows normally, in the time that your kids are at school, the procedure's over and done with.
Incredible.
It kind of blows their mind, and it's so rewarding and so fun to do.
All about giving that confidence back. Dr. Ward, thank you so much. It's amazing what technology can do for us. So
that's cool.
Thank you so much.
Thank you.